Hi, I am Tan Ken Jin. I'm an orthopedic surgeon and I specialize in foot and ankle disorders and surgery. I practice at Mount Elizabeth Novena Hospital. And in this video, I'll be telling you all about getting surgery for your bunions and what the recovery is like. So a typical journey of a patient coming for minimally invasive bunion surgery. So this person will make an appointment to come to the clinic, we'll meet them, we'll have a conversation about how the bunions have been troubling them and for how long. Of course, we'll take off their shoes and examine the bunions. We want to see and make an assessment how severe the bunion is, as well as check the range of motion in the big toe. So typically, if we are taking the process one step further, we'll then do some x-rays with the person standing on both feet so that we can have a good, accurate assessment and measure the bunion angles. Thereafter, if we are coming in for surgery, usually you'll be admitted on the day of surgery, and actually in the surgery what we're doing is we're making some keyhole incisions and using some fine specialized equipment to make fine cuts to realign the bones. Realignment of the bones then allows us to correct the bunion. Once we've done that, then we will usually have to use some small tiny titanium pins to hold the bone in place. This procedure typically takes about 45 minutes for each foot. So in an open bunion surgery, typically what is done is your surgeon or the surgeon will need to make a fairly long open incision over the inner side of the foot where the bunion is. After that is done, that will allow the surgeon to expose the bone as well as the bunion. And then the surgeon will then need to make some cuts in the bone to realign the bone. And typically in an open bunion surgery, he would be using a power tool with a surgical saw like this to make the cuts in the bone. So in a minimally invasive bunion surgery, the surgery proceeds quite differently. We would no longer make a large incision over the inner side of the foot, but rather we use a tiny little specialized blade called a beaver blade. So you can see this blade is really small and is used to make tiny little keyholes over the inner side of the foot. Once the keyhole is made, then because the keyhole is very small and you cannot see or touch the bone or feel the bone well, typically we will need to use an x-ray to guide the surgery. And because the hole is very small, we couldn't possibly fit the surgical saw into that hole. And so a very different tool is used. And this is a surgical burr, which is like a small side cutting drill. And you can see it's really fine. And this is then put into the keyhole to make fine cuts into the bone to correct the bone. Generally, minimally invasive bunion surgery, when done by an experienced doctor, is very low risk. Obviously, there are some small risks of wound healing issues as well as infection and bleeding, but this is very much less for minimally invasive bunion surgery, being keyhole surgery. Occasionally and very rarely, we see bone alignment risks, where we have realigned the bones, but then we lose alignment on the bones. And this typically occurs in people who are a little bit older, such that when their bone density is poorer, or in a very severe bunion, when someone has waited a really long time to get the bunion surgery done. So this is another reason why we encourage people to consider correcting their bunions before they're too severe. So there's very good data to show that minimally invasive bunion surgery has a steep learning curve. So the surgeon actually needs to do quite a number of cases before he becomes adept at doing the surgery. This is because most orthopedic surgeons are very used to doing surgery with an open wound and using a surgical saw. So this type of surgery is used in all other joints of the body. So it's very familiar to orthopedic surgeons to do surgery that way. But minimally invasive bunion surgery involves a small hole where we cannot feel or see the bone, and we are not using a surgical saw but rather a small little side cutting drill that we showed you earlier. And so this is something that's not familiar to most orthopedic surgeons, and that's why the learning curve actually takes some time for the surgeon to be experienced enough to do it well. Most people who come in for minimally invasive bunion surgery will be admitted on the day of surgery and hospitalized. They will also be using a hospitalization insurance for the surgery. The surgery potentially, because it's minimally invasive, can be done as a day surgery or it can be done with a one-night stay. Well, unfortunately, the surgery is not scarless, but you have a much smaller scar compared to open surgery. There are a few small keyholes. Each little keyhole is specially made for a specific purpose rather than one large incision. It's not impossible for your bunion to recur after surgery. One reason is because we don't truly understand why bunions form in the first place, and we're not able to correct someone's genetics or their biomechanics. However, when we correct a bunion well, there's no need to worry of the bunion recurring anytime soon, and for the majority of patients, the bunion never truly recurs to a point that they need to do another surgery. The recovery after minimally invasive bunion surgery is typically not as bad as most people think. Usually there's minimal post-operative pain, and you may need to just take painkillers for maybe 3 to 5 days. Most patients in the hospital will do a session of physiotherapy where they're walking with a post-operative bunion sandal. And so they can use these sandals to walk around at home, and sometimes use another separate clean pair of sandals if they need to go out to run errands. You would need to wear these post-operative sandals typically for 4 weeks. After 4 weeks, we will usually do an X-ray, and if the bones are setting well, then there's no further need to wear these sandals. In the second month, most people will resume non-impact sports. This can be things like swimming, using a stationary bicycle, going to the gym for some resistance training, yoga and Pilates. In this time, usually people are advised to wear comfortable cushion footwear or open cushion slippers or sandals. This is because there's still a little bit of swelling in the second month, although the feet don't hurt. From the third month, usually people's swelling in the feet begins to resolve quite dramatically, and they can start wearing whatever shoes that they find comfortable, including some low heels. However, it may take a little bit longer to fully do impact activities such as going for long runs or jumping kind of sports. If you, your friends or family have painful bunions, remember that they are a very treatable condition, and I would recommend that you can consult your doctor to understand more about your treatment options. Please watch the previous video if you'd like to refresh your memory on caring for your bunions and your treatment options. Like, comment, share and subscribe to Medical Channel Asia for more information.